if you can get liquid soap, that does work easier. You can even use dishwashing soap. In fact, I wash my hands in dishwashing soap often. Now, a lot of people like the antibacterial soap, and that's fine if you're not sensitive. Um, I have a little alcohol-based hand sanitizer, and get yourself a nail brush or a vegetable brush, and we're having flash flood watches and tornado watches all day. Depending on how they're labeled, basically the shape of your brush should be like this. These are very inexpensive, little $1 or $2 brushes. So first of all, you want to clean the area. I'm using my kitchen sink for instructional purposes, but if your hands are contaminated from a sneeze or a cough or coming in from outdoors or taking care of someone sick with upper respiratory symptoms, don't wash them in the kitchen unless you're cooking. If you just finished caring for someone or cleaning the house or something, always wash them in the bathroom. Make sure your water is reasonably warm. Wet your brush. Wet your hands. I'm teaching you what I know from being a registered nurse in the hospital, in surgery and labor and delivery particularly, for 30 years. I also used to teach scrub techs and New Orleans. Okay. You're going to need to take some precautions if you're dealing with this virus and somebody is sick or you are. First, you know you want to get rid of the jewelry, because jewelry actually harbors lots of bacteria, loads of bacteria. And I hate to tell you, ladies, but the artificial nails are absolutely mostly filthy unless you know how to wash your hands and you're doing it. Okay, so we're going to use the box technique. First, we're going to begin with the palm. I'm going to scrub really well, get in circles. Then you'll do the top of your hand. All the way to the wrist bone. All the way around. Periodically, you can get a little more soap as you go. Then you're going to do the nails. If you're out and about in public, in the airport, and the restaurant or wherever, and you don't have a nail brush, you can always clean your nails by rubbing them this way. Gather your fingers up and scrub them in the palm of your hand. Now, we're going to do the nails. Then we're going to start with the box method, which is picture your fingers being four sides. The bottom, the top, the inside, and the outside. So, you're going to wash the outside. This is a proper scrub. I'm making it quick. So then I'm doing the inside. I'm going between the fingers. This is extremely important. I can't emphasize that enough. Nails and the middle of your fingers. So now we're going to go down the middle, across the top, get the end there, down the side, down into the groove again, up the side of this finger. You don't have to do it exactly the same way on every finger all throughout the scrub. Then you go back to the hand, rinse your brush, and you do it all over again, okay? Now, You don't have to do like a proper scrub, but you know, if you have somebody that's actually sick in the house and you know they have coronavirus, or you really feel like they probably do, you really should do a really proper scrub. Do both hands, rinse frequently in between your scrubs, and then at home you'll rinse from the wrist down. From the wrist down. Why? Because it's our fingertips that we work with all the time, and the wrist being higher on the arm is going to be less contaminated. So once we have both hands done, we rinse the brush really well and we set it aside. Okay. See, now I've washed my hands. Now normally we don't do this. That's a normal hand wash at home. If you really want to keep it clean, once you rinse your hands with soap, get yourself a paper towel if you have them. A regular towel will have to work if you don't, but leave it just for hand washing. Take the towel and turn off your faucets. Can you see that? Probably not. It's in my cabinets. There you go. Turn the faucets off. Then dispose of your towel.